Megan, let's start with schools. A lot of parents were sitting at home going, are my kids returning on January 5th or will this be delayed? We now know the answer to that. The question was asked, what changed? Only last week we heard that they were going to return on January 5th.
Yeah, it's been quite a roller coaster for parents and teachers and education staff in this province over the last few days, Hannah, because yes, it was on Thursday that Dr. Kieran Moore announced that instead of kids going back to class today as originally scheduled, they go back to class just on Wednesday of this week. And then that 2-day delay was just meant to give schools more time to implement some further safety measures, to get N95 masks out to school staff, get more HEPA filters out to the classrooms. But he had said at that time he was confident in the decision to send kids back to school on Wednesday, talking about how they have sacrificed so much already. So as far as we knew, that was going to be the plan. But obviously things changed over the weekend, Hannah. And when Premier Ford was asked what changed, he mentioned it sounded like he was shown some new modeling projections, perhaps, that have helped change his mind and prompted him and his cabinet to impose all of these restrictions. Showing him just the sheer number of cases that we're seeing in Ontario and the number of hospitalizations that could result from those cases. He said he talked to CEOs of companies, healthcare leaders, and that he made a decisive decision, he said, about these restrictions coming in as well as keeping schools closed. He defended how his government has been handling school safety. He gave a lot of kudos to his education minister, Stephen Lecce, who was scheduled to be at that news conference, Hannah. I could only hear it, I couldn't see it, so I'm not sure if he actually was in the room or not. We didn't hear from him. If he was, not taking any questions if he was there in terms of the decisions that are being made. But the big question as to why they changed their mind and why they're keeping schools closed, Kieran Moore explained it too. It's basically about buying time. And they said they need to basically reduce social contacts, and closing schools is one of the ways of doing that. They need to protect the healthcare system. So they're hoping these extra days of keeping schools closed will help keep cases low. They said we can't stop the spread, but they are trying to slow the spread of the Omicron variant in order to protect the capacity of the healthcare system.
Megan, there was a really good question from one of the reporters there. What's being done to reinforce the schools during this time? I didn't hear a clear answer, did you?
I think they just repeated mostly what they had said last week in terms of the measures that they're putting in place. So enhanced masking, for example, N95 masks being provided to staff if they want to wear them. They're also sending out other higher quality masks for students to wear if they want to. More HEPA filters going out to the schools, enhancing the screening tools that students and staff have to do before they go to school. So I think that was their answer in terms of what else they're being done. But again, we heard them say throughout the news conference, Hannah, get your booster shot, that's important for those who are eligible for it. Again, to get those numbers up. As we know, some people in Ontario have been having trouble getting a timely appointment. There have been calls from the teacher unions to prioritize education workers to get their booster shots, much like healthcare workers were prioritized and they were eligible for their boosters before the general population. That was not a decision made by the Ford government to bump education workers up the line to get their booster shots. But that is one thing that some education workers had been calling for.
Yeah, and you were noting today there was a pharmacist who was in Toronto who was making sure that teachers got their third shots, prioritizing them, and some frustrated teachers in line there. Let's move to one of the other big stories out of this is they're also pausing all non-urgent surgeries. Tell us how long that will last and what does this mean for the healthcare system?
And what does it mean for patients, right? This is a very significant decision made by the province. So again, just to reiterate, they are instructing hospitals across the province, doesn't matter where, to pause all non-emergent and non-urgent surgeries and procedures. Again, this is about preserving the capacity of the healthcare system, both in ensuring that there are enough beds for patients, but also the staff to care for them. Now, in terms of how many people might be affected by this, Hannah, Matt Anderson, the CEO of Ontario Health, said he couldn't put exact numbers on it, but that they typically typically do about 8,000 to 10,000 procedures and surgeries a week. And he said those will be affected by this new directive. Now, already Ontario had a huge backlog of procedures and surgeries from the first couple of waves of the pandemic when surgeries and procedures were paused. They've been trying to clear that as fast as they can, but now with the pause being put in place again, that backlog will grow. And this is devastating for some patients who have been awaiting procedures. They may not be urgent in terms of the eyes of the healthcare system and people making these decisions, but for the people affected by them, of course, this is stressful news and not good news for them. And there was not an end date to this directive, Hannah, not that I heard, that it will be in place for the time being, as long as necessary. Again, it's the need for the beds, but also the staff, because when patients are in intensive care beds, for example, it's not just one doctor and one nurse that tends to them. It takes a whole team of healthcare providers to care for that one patient. And some hospitals are already struggling with staffing shortages because either they are sick themselves with COVID, or perhaps they've had a close exposure and they have to be in isolation for a few days. We're already seeing this, and based on the modeling that Ford said he's seen, this situation is projected to get worse for the hospital system.
And Megan, just quickly, because we have a doctor waiting to talk about some of these situations that we're talking about here, but there are other measures. Can you just go through those quickly, some other measures that are being put in place in Ontario as well?
Yeah, and these new measures take effect on Wednesday of this week and will be in place for at least 21 days. So that brings us up to January 26th. But again, that's all subject to change depending on what's happening with the case numbers and hospitalizations. So this means social gatherings are going to be limited to 5 people inside and 10 people outside. That's down from 10 people inside and 25 people outside. Bad news for restaurants and bars. They are going to be closed as of Wednesday. No indoor dining, takeout and delivery only. Patios will be allowed to be open, Hannah. It's about minus 14 or 15 here in Toronto today, but they are allowed to operate if they can, with some restrictions. Also, closures of concert venues, movie theaters, museums, galleries. Gyms are closing as well. Again, retail stores are still allowed to be open at 50% capacity. That's what it is currently. Those restrictions went into place last month. Shopping malls are still allowed to be open, but the food courts have to close. Personal care services are still allowed to be open, but again, capped at 50% capacity. And businesses are required to ensure their employees work from home unless their work specifically requires them to be on site in a workplace. So there's more, Hannah, but those are just sort of the highlights of some of the restrictions announced today. Again, they go into effect this Wednesday.